Hello, I'm Jeremy Fernandez. Coming up on the virus, the climbing COVID-19 caseload puts authorities on edge. Plus, the financial burden of the pandemic is revealed. Australia posts its biggest budget deficit since World War II. First, though, Victorian officials are boosting resources to fight the outbreaks that are showing little sign of slowing down. Over the past 3 weeks, the number of new cases has been rising steadily. And on Wednesday, a single-day record was set with 484 cases confirmed. The affected areas are now in a 6-week partial lockdown and face masks have become mandatory for residents. The Premier, Daniel Andrews, says he'll have to extend the measures if the numbers don't come down. Another worrying trend is the number of deaths in Victoria. More than 20 people have died this week alone.
Whenever you have hundreds of new cases a day, that there will be several people who are expected to die in the following 2-week period. I'm afraid we will see that.
This is the reality we face, and unless we all follow these rules, then people will either get a fine, it'll take longer to get past this second wave than would otherwise be the case, and people will die.
Most of the recent deaths have come from outbreaks in aged care facilities. These coloured circles represent clusters with more than 10 cases. Confined spaces and high concentrations of frail people are a dangerous mix in this environment, and carers want to be able to move affected residents out of some facilities.
Hospital is the best place for someone who's got COVID to go to get a good health outcome, but we also have additional residents who we're responsible for. There may be another 100 people, and if we want to have a chance of stopping the spread, we actually need to be able to move people to hospital or another facility where they can get the care and treatment that they need.
So let's take a broader look at the figures now. Of the 7,400 cases identified in Victoria, more than 3,700 of them are currently active. As you can see, that figure has jumped dramatically since the start of the month, when there were only a few hundred cases. Those active cases are spreading beyond Victoria's borders too. Every state and territory now has a confirmed active case traced back to outbreaks in and around Melbourne. That's the first time in 11 weeks that all Australian jurisdictions have reported at least one active case. In Victoria, 206 people are in hospital, including 41 in intensive care. And while elderly people are still the main priority for emergency services, people in their 30s, 40s and 50s are also being cared for in medical facilities. Nationally, there have now been more than 13,400 confirmed cases. The high numbers in Victoria even pushed the national 24-hour tally above 500 for the first time nationally. 140 people have now died. Victoria has now recorded more than twice as many cases as New South Wales. This week, local outbreaks became Australia's main source of infections. Previously, most cases were from overseas travellers, but those overseas arrivals have now slowed to a trickle, and local transmissions, both known and unknown sources, now account for the majority of the spread. The growing number of cases in New South Wales, meanwhile, has forced authorities to reintroduce some restrictions. Over the past 2 weeks, the caseload has been consistent, peaking at 20 cases on Monday. Group bookings at restaurants, cafes and clubs will now be limited to 10 people. The number of patrons inside any venue will be capped at 300. Weddings and corporate events will be limited to 150 people. And only 100 people are allowed to attend funerals and places of worship.
If there is a business or an organisation that are blatantly flouting the law and putting public health at risk, I will be the first to name and shame and condemn them.
The government says it'll keep aiming to suppress the virus instead of taking the approach of eliminating the virus altogether. If National Cabinet were to pursue elimination, more severe lockdown measures would be put in place in the affected areas. Doctors say this second surge in Victoria shows why a stronger approach is needed. The Prime Minister says he thinks, though, National Cabinet is getting the mix right so far.
There will always be cases that come because Australia has not completely shut itself off from the world. To do so would be reckless. But that no community transmission, where the vast majority of states and territories have been at now effectively for some time, and that's certainly where we want to get back to in Victoria and New South Wales, and that's where our efforts are focused.
So those climbing caseloads in the nation's 2 most populous states have the authorities worried. Earlier I spoke with the ABC's medical reporter Sophie Scott and the University of Melbourne epidemiologist Professor Tony Blakely for their perspectives.
My theory is as follows, and I think it's been borne out by the data in the last week. We had the first epidemic, if you like, in the first 12 postcodes, and that's probably come down a bit. Then we had the rest of Melbourne going in, it came up like this. And then we've had the essential workers like this. And by the time you join those three curves that we don't see separately, you end up with a humped mountain. You're going up the tabletop, and then you're on a long plateau, because those things are occurring in series. That's why the numbers have stayed up. So the position we've got at the moment is that the essential workers, unfortunately, are propagating the outbreak at the moment. I say unfortunately because we want them out there. They're part of our economy. The building or construction industry, part of the economic stimulus of the government is through construction, and these guys are out moving through the economy, but unfortunately also transmitting the virus. So I think that's what's happened, and we can talk more about some of the measures to try and deal with that without shutting down the essential worker industry.
Certainly what we've seen in Victoria, which is a concern, and we saw it in New South Wales as well, is the issue of aged care, and there's a number of nursing homes and aged care places in Victoria that are now affected. And there are those essential workers that are going to work in aged care that are potentially transmitting the virus from one aged care centre to another. And many of them are casual workers, and they work in a number of different facilities. And so that's been identified as a key area of concern, both in Victoria and also by National Cabinet today, to make sure that Victoria doesn't see the repeat of what happened in New South Wales with the couple of aged care nursing homes where we had a lot of fatalities and an absolute tragedy for those families. And that's what we don't want to see happen in Victoria. But unfortunately, the figures today with the number of deaths and being in older people and people in their 80s and 90s in nursing homes, we're starting to see that. So that's a real concern. That's a real pivot point. And that's a real red flag that the National Cabinet's identified. And today they've effectively said to the states today, which is interesting, we want more information. So, while the states have been very good at having press conferences every day and giving out as much information as they can, it's clear from that the meeting with the press conference today with Scott Morrison that they want more information too about what's going on with aged care, with intensive care, with contact tracing, to find out if there are lags happening and what can be done about it, because there is obviously a couple of things that are still breaking down in the system.
Professor Blakely, you've done a lot of modelling on this, haven't you? What's your outlook for aged care in particular?
I haven't done aged care, but I want to jump in on some things that Sophie said that I think are really important. First one, she talked about those essential workers going between the rest homes. We need to do this smarter. So imagine we had a crew of 6 people in a cleaning gang and they went to 3 rest homes each day. Bob, Bob, Bob. That's nuts, because they're going to transfer it between. So we take those people and we say, work as a 2-person cleaning gang and only go to 1 rest home. So there's some really sensible stuff. The second thing that Sophie said that I thought needs reinforcement is the data. So in Victoria, we're starting to get policy or the daily strategies informed by the data, for example, the essential workers. And I'm delighted to hear that the feds want to see more of that data too. So I think those points need reinforcement. I think Sophie's right to bring them up.
Sophie, you were monitoring that National Cabinet. This issue of suppression versus elimination came up. What did you learn?
There has been a change in the language, and I think it was one of the deputy medical officers that used the word. I think it was aggressive suppression or radical suppression, or some slight change to the language, which seemed to suggest that they were moving more towards elimination. I mean, one of the big factors in the debate that isn't often drawn out when you're talking about the elimination versus suppression, and I'd be interested in hearing Professor Blakely's view, is if you go for elimination, which is great in theory, but how can that continue once we open our borders up? And that's one thing that I think we don't often consider. So if we have no virus circulating in Australia, like they do in New Zealand, there's virtually no virus circulating there, how do we maintain that once we open borders up from around Australia and also around the world? Because that would then be a risk, obviously, if people were bringing it back into the country. So how can we, I'm interested in Professor Blakely, asking him, how can we maintain that strategy, but at the same time have some opening of borders, which obviously people would want in the long term?
I'm very pleased to jump in here. Thanks, Sophie. So I'm going to talk about 3 things. I'm going to talk about the wording from the Prime Minister today, and then about the definitional issues, which I think we can largely then throw behind us because I think we're done with that after today, and then the how-to, which is what Sophie was getting to. I have the wording from the Prime Minister. I'm going to read it to you because it's really interesting. He said, A couple of other points that were agreed on today was an affirmation of suppression strategy. So he's basically saying we're still doing suppression, but listen on, that we've been working to nationally now for many, many months from the outset. Listen to this though, next sentence. The goal of that is obviously and has always been no community transmission, which is what we have been defining as elimination for some time. So let's get to definitional issues now, the second point. When I say elimination, I mean no community transmission. That is those cases that pop up somewhere, and you can't find the source. So that means the virus is endemic somewhere in your community. It does not mean no cases in quarantine where people are at the border for 14 days in quarantine. That is not what we're talking about. So this is really good news. It appears, and I think Scott Morrison has moved his position on this, but he's making it look like he hasn't, is that they have a goal which is the same as the elimination goal. No community transmission. Excellent. The key issue now is how do we do that, which is the third point in Sophie's question. So, Sophie, to come back first, it doesn't mean closing the borders. It means really good quarantine at the borders. But we know that quarantine is not always perfect. We should be getting better at it.
And hopefully there'll be some good lessons to learn from what happened in Victoria to make sure that doesn't happen again.
I completely agree. But look, it's not rocket science. People are in there for 2 weeks. You don't let them mix with the other inmates, to use a prison analogy just for a bit of humour. I'm not trying to say it's like a prison, because you don't want people at the end of their quarantine to be mixing with people who've just come in that might be infective. So you've got to keep people separate, and then you let them out after 2 weeks, and you do some testing at the beginning and at the end to give you extra confidence. And if they don't want to be tested towards the end, you extend the quarantine from 14 to 21 days, and there's 0.0001% of people would still be infective 21 days later, so it's minimal. So that's the first step, good quarantine. But, and this tinderbox analogy has been used quite a bit recently. Think about WA. They're back in the sports stadiums with 30,000 people in there. If a virus got in there, it would just go kaboom. So you would have heard Paul Kelly and others in the last 10 days saying, please, 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 WA, citizens, keep your physical distance just in case. So you still need to be behaving in COVID-safe manner. And the final thing, and this is mission critical, and this is another mistake we made, well, something that didn't work in Victoria. The community contact tracing, testing, and surveillance systems are critical, because if a case does sneak through somehow, you need to be able to stamp it out so quickly. There's a great paper just published in one of the top journals today where they actually analyse how you do that really well and get that effective rate less than 1, so that if something happens, you drive it down. That strategy was our strategy in Victoria, that we built up that capacity in the first lockdown, ready to jump on an outbreak if it happened, and it failed because we lost control. So we need to do that better. I think New South Wales is doing it better than us.
Week after week, we get a lot of questions, people asking about masks. And this week, a number of people have said it feels really uncomfortable to breathe through a mask. Some people are asthmatics and they find it sort of suppresses their breathing even more. What are your thoughts around that? And do you have any particular tips on how people can become accustomed to this new way of living, particularly in areas where physical distancing is difficult to do?
Yeah, so there are a couple of points there, Jeremy. So the advice is for the Victorian Health Department, where obviously in Melbourne and other places now masks are mandatory, that if you have a medical condition such as asthma, you actually don't have to wear a mask. So I double-checked that this morning before we came on air. So I know we've had questions from people who say, my children are asthmatic, they can't wear a mask without coughing. So in that instance, then they don't have to wear one. For the rest of us, wearing a mask we're not used to it. We don't have a culture like in some Asian countries where people are very comfortable wearing masks. You see them all the time, and you have for many, many years. It's a new phenomenon for us. So I think accepting that it's going to feel a little bit uncomfortable is probably a good first step. It's not going to feel natural. We're not used to wearing them, but that doesn't mean we can't get used to wearing them. What can often help, because, if some people feel like they can't breathe properly, you can use to try to breathe through your nose a bit more rather than breathing through your mouth, using that nasal breathing and trying to breathe a bit more deeply into your diaphragm rather than just focus on that shallow chest breathing that can make you feel a bit more anxious anyway.
Sophie Scott there with Professor Tony Blakely. Well, the pandemic has devastated Australia's finances too, and while the government's job-saving packages will be extended, the payment amounts will be slashed. Our National Affairs correspondent Greg Jennett takes us through the figures.
The numbers are brutal. The financial year that ended 24 days ago was not the $5 billion surplus last forecast. It was an $85 billion deficit. The one we're now in will wind up in 11 months, $184 billion down the hole. Deficits come from borrowings that build into a pile of debt. $488 billion now, a record $670 billion by June next year. The interest repayments alone, $16 billion a year. By Christmas, unemployment will have peaked at 9.25%. It's what comes with recession. Come the end of September to early in the new year, JobKeeper's flat rate of $1,500 a fortnight's gone. $300 will be sliced from full-time workers. And for part-timers, even more. Work fewer than 20 hours a week and get $750 for the fortnight. Next, 2021 brings a further cut. $1,000 for full-timers, $650 a fortnight for part-timers. Then there's the dole. Job seekers taking a $300 hit each fortnight too, down from $1,100 to $815 through to New Year's Eve. By then, the government reckons the 1.6 million people receiving it will have grown to 2 million. All will be required to actively look for jobs. And if they find one, each will be allowed to earn up to $300 a fortnight without losing the dole.
First a city, then a country, then the world. With reports of deaths on most continents and no vaccine in sight, the questions remain. How far will the virus spread? How many lives will it take?
Now, globally, the infection rate continues to rise steeply. Almost 15.5 million infections have been recorded, and there have been more than 630,000 deaths. New hotspots have also emerged. India is now the third most affected country. South Africa has now recorded more than 400,000 new cases. However, the Americas are still the main cause for concern. Health authorities there say the spread of the virus is still surging through the most affected countries, the US and Brazil. 7.7 million people have been infected in that region and more than 300,000 have died. The latest figures from the US show that the average number of cases is rising by 2,600 an hour. And as you saw before, India has the third highest number of infections in the world, and it's spreading at its fastest rate since the start of the pandemic.
When this 34-year-old coronavirus patient felt his life slipping away, he grabbed his mobile phone to say goodbye to his family.
Bye, Daddy, bye. Andarki bye, Daddy.
He died just hours later.
I begged with the nurses to do something. Why would they keep a patient with such severe issues in a general ward? He should have been moved to the ICU.
Indian healthcare workers have been trying to put a brave face on this pandemic, but various stories of neglect are fueling distrust in the public system.
My brother wanted to get out of hospital, otherwise he said he would die.
India's fourth largest city, Hyderabad, is combating a surge since a nationwide lockdown was lifted. Doctors and nurses fighting the infection with already limited resources are at breaking point.
Sweating. So mainly is dehydration. They cannot even go to toilet in between.
We have started surging and we are still in the ascending phase. Once we touch the peak, we will be in plateau for some time.
And there's still a long way to go, with India's peak expected to be months away.
The number of cases, meanwhile, in Papua New Guinea has more than doubled to 30 in less than a week. The spike has been linked to an outbreak at Moresby General Hospital, where health workers and lab technicians have been infected. New restrictions are to be enforced, including the mandatory wearing of masks. Well, thank you for joining us. If you want to see more of that conversation with Professor Tony Blakely and Sophie Scott, just go to the ABC News YouTube and Facebook channels. We'll be back with more next week. Thanks for your company. Goodbye.